Hello, today we are going to discuss about carpal bones. As we all know that there are 8 carpal bones arranged in 2 rows, a proximal row and a distal row. There are 4 bones in the proximal row and 4 bones in the distal row. In the proximal row, there are scaphoid, lunate, then it is triquetral and pisiform, and the distal row consists of trapezium, trapezoid, capitate and hamate. Now we can discuss about the identification features of each bone. Coming to the scaphoid, it is the board-shaped bone. We can say that it is a board-shaped from its shape. Next is lunate, and it can be from the word itself. It is a half-moon-shaped bone which is having a convex proximity and a concave surface. Coming to triquetral, it is a wedge-shaped bone, and then coming to pisiform, which is the pea-shaped or smallest bone. Then coming to trapezium, from the name itself, it has a trapezoid shape and trapezius shape, and it has a ridge in it. Coming to trapezoid, it is a boot-shaped bone, that is a small shoe-shaped. Coming to capitate, which is the largest of the carpal bone, it consists of a head, rounded head, and which can be identified easily. Coming to hamate, it has a hook. We can identify it easily from the word. Now we can discuss about the arrangement in an articulated hand. From lateral to medium, we can discuss it as scaphoid, this is scaphoid, and this is lunate, this is triquetral, and it is pisiform. And on the distal row, we have trapezium, trapezoid, capitate and hamate. This is a hook of hamate. We can palpate easily and can be identified easily. Now we can discuss about the attachments of carpal bone. For easy to study, we can study it at scaphoid, lunate and triquetral. It has attachments to the capsule of wrist joint, and only 4 bones have muscular attachment. These are pisiform, then this is trapezium and capitate and hamate. Pisiform, it has attachment to flexor carpi ulnaris tendon, because pisiform, we know that it is a sesamoid bone of flexor carpi ulnaris. Sesamoid bone is a bone which have close origin or proximity to a tendon. Then it also has origin of abductor digiti minimi. Coming to the attachment of trapezium, it has the origin of opponens pollicis, and it also forms first carpo-metacarpal joint. Carpo-metacarpal joint means it has a joint from carpal bone and the first metacarpal bone. Coming to the attachment of capitate, it has origin of adductor pollicis, and coming to the attachment of hamate, it has opponens digiti minimi origin. We can now say about the attachment of flexor retinaculum. It has a medial side and an lateral side. Medial side, it is attached to the pisiform and hook of hamate. Lateral side, it is attached to the tubercle of scaphoid and crest of trapezium. Now coming to the attachment of extensor retinaculum, only medial side has attachment to the carpal bone. It is attached to the pisiform and triquetral bone. Just going to the ossification, these bones are cartilaginous at birth and later it ossified with different centers, and it follows a spiral type of ossification pattern. The first to ossify is capitate bone and the last to ossify is pisiform bone. Pisiform bone has 4 peculiarities, and these are this is the smallest carpal bone. It is pea-shaped bone, and it is a sesamoid bone of flexor carpi ulnaris tendon, and it is a last to ossify. Coming to the clinical correlation, there are 2 clinical correlations. First is fracture of the scaphoid bone, and next is the dislocation or dislodgement of the lunate bone. Fracture of scaphoid bone, this fracture occurs at the narrow waist of the scaphoid, and it mostly occurs when one falls on an outstretched hand. The blood vessels of scaphoid enters through both ends, and due to the fracture, there may be a damage to this blood vessel, and due to this, the distal part of scaphoid undergo an avascular necrosis. And due to the fracture of scaphoid, there may be a tenderness, and this tenderness can be felt in the anatomical snuff box. Coming to the displacement of lunate, and this happens when one falls on acutely dorsiflexed position of the hand, and this can cause Kienbock's disease. Hope you all understood about the identification and clinical correlation. There is a mnemonic to study the names of the carpal bone. It is, she looks too pretty, try to catch her. And this is the order from proximal and distal row. She looks too pretty, that follows scaphoid, lunate, triquetral, pisiform, and try to catch her, trapezium, trapezoid, capitate and hamate.